Hello everybody, my name is William, and for my clinical specialty gastroenterology, I'm going to be performing an abdominal exam. So before I can do that, I'm going to clean my hands with alcohol-based sanitizer. And usually we close the curtains, privacy purposes, but to film the video, we won't do that. So hello, what's your name?
Cody.
Hi Cody, I'm William. I'm going to be your gastroenterologist today. We're going to be performing an abdominal exam, so I'm going to look at your hands, your eyes, your mouth, palpitate your neck, and do the abdominal exam itself. So is it okay if I touch you?
Yes.
All right, I'm going to need your hands. So I'm going to check if there's any clubbing on the fingers. No clubbing, that's good. And then I'm going to check his pulse using the radial artery. It's fine. And then check if there's any tremors. His hand outstretched, and there's not, and I do the same thing on the other side. So next, I'm going to use my handy dandy pen light. Open up a little bit. And then if you look up for me, and then I'm going to look in his eyes to see if there's any jaundice, where there's a ring around his eyes, anything like that. Luckily, there is not. Next, I'm going to check his mouth, so can you open wide? And I'm going to look for ulcers. That's a sign of Crohn's disease or IBS. His tongue is not discolored and maybe a little dehydrated, but that's nothing too bad. So next, I'm going to have you sit up. Actually, before that, I'm going to put you down, and then I'm going to sit you up. Good. Now, can you sit up for me? Now, I'm going to palpitate the supraventricular node on the neck. Make sure they're not enlarged, and especially the left one. And they're not enlarged. So, I'm going to move the pillow right here. And now, I'm actually going to have him a little bit more up this time. Just so I can see his facial expressions to see if he's in any pain when I do this. So I'm going to lift up his shirt. It's about right here, and we're going to do the exam. So first thing I'm going to do, palpitations. How do palpitations work? Well, instead of digging in right here, that should hurt. I'm going to push a little bit in, and my knuckles are going to be that pushing force. And I do it in all the nine quadrants of the abdominal wall. So I'm going to do it superficially, so that means not too hard. All 9 quadrants. Uppers now. Good. Now we do it deeper. Make sure to look that there's no pain. I don't see any pain in his eyes. All right, good. Now, what I'm going to do is I'm going to push down and push back up, see if there's any pain. Again, all 9 quadrants for all of these. Also, when you're doing this, if you can feel a mass, make sure to take note of its size, location, and shape. Now I'm going to check the liver. And so for the liver, usually we're gonna check if it's not palpable, and usually it's not palpable. So we're gonna start up here, or not up here, down here. Palpitate, palpitate, and again, it shouldn't be palpable, but if it is, you're gonna do percussion. How you would do percussion, you would do it on the perimeter of the liver. That's how you do it. 2 fingers right here, and it's all around the perimeter. And now I'm going to do the spleen. And this is kind of the same thing with the liver. You really shouldn't be able to palpitate the spleen. But if you do, if you can, you could do percussion. So you're going to start the LRQ. Go diagonally to about the 9th rib cage. So right here, I don't feel anything, but you would, if you could, you go along the notch border. Percussion. Now we're gonna look at the spleen, and not the spleen, the kidney. So I'm gonna do the left kidney first. And so I'm gonna grab his loin, rotate him a little bit this way, grab here, and the kidney is normal size. I do the same thing on the other side. However, like I said, you can't really palpitate the kidney, but in thin people, you can feel the pull of that right kidney. And last thing we have to do now is I'm going to check his bowel sounds. Bowel. And so I'm going to be in the iliac fossa, which is about right here. And I'm going to check his bowel sounds. Usually you'll have to wait a bit if they're very quiet. And I can hear him. So everything looks okay with you. You have no problems. If you do have any problems, make sure to let us know. But otherwise, you're done for today.
All right.
Thank you, everybody.